Hi, my name is Rachel Lundeen, and today I'll be informing you about abortion. Approximately 42 million abortions occur every year worldwide. Every year there are many unplanned pregnancies that end with abortion. Although every citizen has the rights in this country, there is different beliefs on abortion and how it affects a woman's life and what to do in this kind of situation. What if it was your mother, your friend, your girlfriend, or your daughter that became pregnant? How would your views change in each situation? What would you want her to choose? First off, I'm going to share with you a little bit about abortion. Abortion means to end a pregnancy altogether. It can happen anywhere from 1 week in pregnancy to 24 weeks. There are two different kinds of abortions that can occur. The first is an in-clinic abortion. This involves removing the fetus from the woman's body. There are 3 different ways of removing this, one for each trimester. During the first trimester, which is the first 3 months of pregnancy, a suction apparatus is used. This is where the baby is sucked out by a vacuum through the cervix. During the second trimester, which is the second 3 months of pregnancy, D&E, dilation and evacuation abortion occurs. This is where the abortionist will stretch open the cervix using metal rods, and because the baby is too large to fit through the cervix at this stage in pregnancy, they will have to tear the baby apart in pieces to get it out. They will break off parts of the body and pull them through the cervix in order to remove it. Finally, during the last trimester, DNX abortion takes place, which is also known as partial birth abortion. This procedure takes 3 days total, and it can only be done if serious health conditions are at risk. The other type of abortion that can take place that is offered is called the abortion pill. This can be done only within 63 days of the woman's last period. This is a 2-process pill. The first pill is taken at a doctor's office and stops an important pregnancy hormone from being produced, which causes the lining of the uterus to break down. The second pill then is taken, which is called misoprostol, and is taken at home. Heavy bleeding and cramps will occur as the uterus empties and the abortion is complete. Now I'm going to be sharing with you the pro-abortion side of the issue. First of all, the Bill of Rights states that every U.S. citizen has rights. Every woman has the right to decide for herself if she wants to go through with an abortion or not. It is legal, so it's only fair that she has the right to decide what to do with her own body. Next is women have abortions because they care about themselves and their families or their future families. There are many reasons why a woman may choose to have an abortion. First of all, she may not be ready to be a parent. She feels too young to have a child, or she can't afford a baby yet. Maybe she doesn't want to be a single parent or doesn't want anyone to know that she has had sex or has become pregnant, maybe for religious reasons. She already has all the children she wants, so she won't be able to care for any more children. Or maybe she was a survivor of a rape or an incest, so she did not want to become pregnant in the first place. And lastly, her fetus may have health problems, so the pregnancy wouldn't be healthy and would have many complications. Lastly, on the pro-abortion side is ultimately most women feel relief after an abortion. An unplanned pregnancy causes unnecessary stress because of the reasons I have just stated. Women tend to feel better after an abortion, but only if they can talk with supportive people in their lives and get support. Now for the con-abortion side of the issue, there are other options rather than having an abortion. The other options available are adoption or parenting. There are many people who would adopt a baby in need of a home, or there are many classes you can take to learn how to become a better parent to take care of your baby. Abortion is not the only way to solve an unplanned pregnancy. Next, there are a lot of risks that come with having any type of medical procedure as well as an abortion. Some of these are allergic reaction, blood clots, incomplete abortion, infections, injury to the cervix or other organs, and very heavy bleeding. Some of the most common ones when dealing with an abortion are infection. Infection can develop from the insertion of medical instruments into the uterus or from fetal parts being mistakenly left inside. Some infection may lead to fever and extended hospital stays. It can also cause scarring of the pelvic organs, which is not good. Next is an incomplete abortion. Some fetal parts may be mistakenly left inside the body after the abortion. Bleeding and infection may result from this because the abortion was not completed properly. Also, complications from the anesthesia used during any type of surgery may result in heart attack and an extreme case death. It may also increase the risk of other serious complications by over 2.5 times the norm. Also, damage to internal organs can occur. If something goes wrong during the procedure, the uterus can be punctured or torn, and there's also a risk of damage to nearby organs such as the bowel and the bladder. Damage to the cervix can happen too because the cervix may be cut, torn, or damaged by the abortion instruments. This can cause excessive bleeding and requires surgical repair to be fixed. Lastly, there is a total body infection caused by the medication abortion pill, and some people have died in this case. Lastly, on this side of the issue, abortion is not only painful physically, but is also painful emotionally. Most women feel pain similar to menstrual cramps during both types of the abortion method. For others, it is more uncomfortable level of pain, and pain medication is supplied, but it doesn't always work. It differs with every woman how much pain she will have physically. For some women, having an abortion can also come with extreme emotional pain, and it can be similar to significant life events such as ending a long-term relationship, starting or losing a job, or becoming responsible for more things in your life. It can be very stressful and very difficult on the woman. In conclusion, there are many things women should consider when thinking about abortion. There are many beliefs on what is right when dealing with abortion, but ultimately the woman has the right to decide for herself. Abortions are legal, safe, and effective, but there is a chance of risk with any type of medical procedure. Other options are available in place of this procedure, but there are many reasons why a woman will choose to end the pregnancy altogether. Many emotions are dealt with after undergoing an abortion, both positive and negative. But overall, there are many ways in which a woman is influenced one way or another. When looking at both sides, there are many controversies involving many different aspects of this issue.